I've got a few things on my mind.
Uh-oh.
There's one thing that I definitely want to talk about, which is very, very concerning, but it is the beginning of Juneteenth celebrations, and I've got mixed feelings. When I think about Juneteenth marketing with sports teams and organizations, it just reminds me, it's similar to the George Floyd response, and then there's little change, and some even being silent on the cultural wars to silence the history of black and brown people, the anti-CRT, anti-blackness campaigns. So I'm just wondering, here we go again. You know, you can just Google, Juneteenth and sports teams, and you'll see all this marketing and beautiful red, black, and green or yellow, and it's sickening. I'm sorry.
I had a similar conversation with some individuals earlier this week about the marketing aspect of it and the true meaning of it, and it just feels like, because unless they hand it to you, it's not okay to celebrate it. Now they've handed it to us. It's like, oh yeah, let's everybody get behind it now. Like, I don't need your permission to celebrate Juneteenth. I've been celebrating Juneteenth for the last 25 years.
They just get a day off. They're excited about that.
Well, it's a way for them to make money too, right? Buy more products. We've got a Juneteenth shirt now for you to wear.
Yeah.
Yeah.
It just feels like, you got to prove my pride. I don't like that.
Yes.
That's powerful.
But the bigger issue, and it's much bigger than Zion Williamson or Denver winning or Las Vegas winning the NHL, it's crisis mode for black women who are pregnant and interaction with our healthcare system.
Yeah.
And so I am reminded again, because I'm not new to this, is the loss of Tori Bowie. Three-time Olympian. She passed away last month.
Yeah, we talked about that.
Which was kind of quiet in the general national news. It came and it went. But then her autopsy report was released just less than a week ago. And so she was found dead in her bed by sheriff deputies in Florida. Since then, in fact, going back to the history on this, 3 of the 4 women who were on that 2016 4x100 meter relay team experienced complications during their respective pregnancies. And so I'm tying this to the sports shop because this is happening all across the country with black women, but we get the PR, we get the attention because they're sports stars who are now, their stories have gone viral, people are hearing about it. And there's no way that if this would have happened with white women, 3 out of the 4 or a sorority or whatever, these types of numbers, that we would not be able to advance this cause. But anyway, she was approximately 8 months pregnant. She wasn't heard from. They requested a wellness check, and that's when they found her. They say possibly she was in labor. Preeclampsia, for those of you who aren't familiar with that, it's a spike in blood pressure, and it's very, very serious. It happens, and it can lead to a preterm birth. And according to the NIH, National Institute of Health, it's pretty rare, and it's more severe, and it can affect brain function, causing a coma or a stroke. Now, here's the news for anybody who just is not aware of this. The United States has the highest maternal and infant mortality rates among comparable developed countries. That's terrible. But the survival rate for black women, for African-American mothers and their infants, is even more dismal. You're like 3 to 4 times more likely than white women to pass away.
Wow.
And for black infants, it's twice that of infants born to white mothers. And despite all of this, 80% of these pregnancy deaths are preventable.
No, that's what I want to talk about now.
Yeah.
That's the
So help me understand that part there, because that was going to be my question.
Yeah. African-American mothers are twice as likely to have an infant who dies by their first birthday. Is there anything more tragic than that?
Right. That's right.
And people will say, well, it's due to them being in a low poverty situation. They don't have money. They don't have resources. Let's break that myth. Even financial status and education don't help. having an MD, a PhD, a JD, having a master's degree. It doesn't matter. There was a groundbreaking, decade-long study looking at births in California, more than 2 million, and found that even the wealthiest Black mothers and babies have a disproportionately higher risk of death than the wealthiest non-Black mothers and babies. I want to quote a gentleman, Dr. Neil Shaw, who's at Harvard. He's at the Maven Clinic. He's the chief medical officer there. He's quoted as saying, "Healthcare system is built on racism. A bad system will beat a good person every time." Now, in my work doing racial equity workshops and seminars, I oftentimes lift up Serena Williams, right? Some of you might remember her story that went viral in 2018 after she gave birth to her little baby Olympia, who's now hitting tennis balls. She was ignored by the nurse. She has a history of blood clots. She had a pulmonary embolism. She knows her body just like we do. And yet she had to basically beg doctors, and she's a VIP diva. She had to beg doctors and nurses for the proper care. Thank heaven she was persistent. They gave her the ultrasound. They gave her the heparin drip. They gave her the scan, and they found out the blood clots were forming. But this is happening over and over again. And we need more people to step up and draw attention to this.
That's right.
I pause.
We're talking about Dr. Strobel. We walk with her each and every Thursday. So what would you suggest, Dr. Strobel?
Wow, there's a lot. I'm going to go through a list here. First, check in with your family and friends.
Mm-hmm.
Accompany them to the doctors.
Right.
Anybody knows when you go to the doctors, for whatever reason, I don't know if just how we're socialized, but whatever, we get nervous.
Oh, yeah.
Now, the worst experience is going to
That's
the
true.
dentist, right? We all get nervous, but it happens with physicians, gynecologists, everybody. So you're not necessarily in your best mind to listen and observe.
Right.
Now, might be illegal, but I'm going to say it anyway. Take out your smartphone, put on the voice memo, record, and put it in your pocket so that you can hear what they actually said. If you can't do that, or if you feel uncomfortable taping it, bring somebody with you so that they can hear and take notes.
Well, Dr. Strobel, I have to interrupt you because the personal point. When I go to the doctor, not only do I record it, but I put Bianca or Erica on FaceTime.
Okay.
So they're there with me to hear everything that's going
that's
on.
good.
Yeah. So anyway, I just want to throw that in there. Go ahead.
That's excellent.
Mm-hmm.
Seek culturally competent healthcare professionals. Now, there's very disturbing research around this. Black babies are more likely to survive when cared for by Black doctors. So what does that mean to Black parents? When we know we don't have a lot of Black physicians.
Right.
Right.
Now, I'm not saying all non-Black healthcare workers and physicians are trying their best to harm or to kill us. I'm not saying that at all. But what I am saying is that the research is pretty clear that when you have people who know the community, who come from the community, you're increasing your odds of better care. And the research backs it up.
Wow.
Seek second and third opinions. Read the research. In fact,
No,
go
we
read
don't do
the
that, no.
research. Challenge your physicians. Don't just walk in and just because they've got degrees and you don't speak proper English that you can't ask questions.
I agree.
Challenge them. There is a bill. There was a bill that was introduced in 2021 called the Black Maternal Health Momnibus Bill Act that would provide $1 billion, which isn't enough, $1 billion to address many of the causes that lead to maternal death. Even though it had 180 co-sponsors, it has yet to be enacted. And Senator Cory Booker out of New Jersey, he reintroduced the legislation. So we've got to stay on top of this. I also believe that we need to screen and treat women at risk for preterm birth. And then we have to eliminate maternity care deserts, just like we have education deserts. We've got banking and finance deserts where there is an absence or very limited amount of services, high quality services in low income areas. We have to figure out what we can do to bring the services to the people. So I'm fired up about this. Not that I haven't been in the past, but to hear about Tori Bowie,
Yeah.
I mean, it's just tragic, and it
Right.
just keeps repeating.
Yeah. We're talking with Dr. Deborah Stroman on Dishing It Up with D. Stroll, as we always do, and having a very important conversation this morning about healthcare in this country, healthcare with minorities, and more specifically, women of color. And Dr. Stroman, I was thinking, and I had this thought about a month or so ago, is I think talking about the system, holding the system accountable is something that we should be more intentional about collectively. And by that meaning, it just starts with your own personal care, right?
Right.
Yeah.
We've all taken our car, to get a diagnostic test or whatever, right? You get a 130-point inspection.
Right.
They go through like this whole list of stuff. They give you these detailed analysis and all these things. Have you ever really gone to just a routine doctor's visit and got a detailed analysis on each one of the things? Each and everything, like a written detailed analysis. It's like, I don't know.
Right.
I mean, you maybe get some blood work back, but other than that, have you really? I mean, have you did they have to write their opinion on where you are with each one of these things?
Well, you're speaking to how the system is broken. It's broken for everybody,
Right.
but it falls harder on brown and black people.
Right.
Yeah.
I have friends who are physicians, and it's become so difficult for them to just spend some quality time with a patient. You've got these 12-minute appointments that are set. You've got to get in, get out. You hear them right outside the door reading your chart.
Yep.
They walk in. Half of them are still looking down at the clipboard, and they're trying to get through because they've got another one and another one in another room. It just goes back to greed and money.
Yeah, that's true. And
But, Go ahead, please.
I was going to say it's even hard, and I've experienced that as a woman, getting the doctor to really listen to you.
Well, they're still looking down at the clipboard or doing whatever.
Right. And just, that's why, women walk away, go home, and have a heart attack because they were just at the doctor. But it's hard. It's so much harder for us to get our point across where they would listen, like, okay, these are signs. I think something is wrong with me.
Right.
Then if you walk in.
Right. Well, most they don't pay attention to us.
Or,
either.
so it's hard in general being a woman and then being the black woman.
You've got to walk in with your crunched over, screaming and crying,
Yes.
blood pouring out of your ears, your arm hanging off to get some true treatment.
Yeah, and some of
Now,
the issue is the insurance.
Oh, that's again, the system.
Yeah.
And again, there are a lot of physicians and healthcare workers who agree with this, and they protest, and they don't like the pressures. But again, the system's broken. Structural racism in healthcare and social service delivery means that African American women often receive poorer quality care than white women. It means the denial of care when African American women seek help, when they're enduring pain, or that healthcare and social service providers fail to treat them with dignity and respect. All this adds up and breaks down the body. It's called a weathering. Dr. Arlene Geronimus at the University of Michigan. It's like triggering a chain of biological processes known as weathering. Dr. Sherman James over at Duke, he does the same work with black men. It just wears us down. It wears us down. And next, it's high blood pressure, it's stroke, it's death.
Weathering. Huh.
Yeah, interesting. Huh?
All right, Dr. Stroman. As always, I appreciate it.
Yep, I do too.
Good
Very
stuff.
much so. Really good stuff.
Well, I know it's heavy, but sometimes, in fact, we should do it more often.
Yeah.
We have to have that 2x4 hit us in the face.
Yep.
And everybody knows when you get your nose hit, it hurts a lot. I mean, just a simple bump, an elbow in a sports event, a hit in the nose hurts. Well, I'm saying let's take a 2x4 and wake us up. We've got to support. We're in crisis mode, and we've got to have more attention in this. And I'm heartbroken that we had to lose another beautiful young lady, 32 years old, gone too soon. But we've got to pay attention to this, and we that hold the microphone have to do our part to lift this up. So I thank you for this time.
Thank you as well.
Thank you.
Dr.
Powerful.
Stroman, before we let you get out of here, I don't know if you've heard, we have a celebrity tennis match that is going to be happening in September.
Yes,
And,
let's go.
Pam will be taking on tennis great himself, V.R. Reese.
Okay, that's what we're doing. Okay.
So we're soliciting, reaching out for all assistance and helping to train Pam, get a
That's
technique
right.
properly done. So your assistance is truly welcome if you would like to.
Absolutely
I think
welcome.
A lot of people who listen and know that Reese is my brother and I love him, but I'm going with Team Pam. Pam, I want to help
alliances
you
are
to
shaky
train
on this
you.
show, man. I'm telling you right now.
I want to help train you and work out.
There you go.
Is it a real tennis match? Are we shortening the court? What are we doing?
No, this is not pickleball. No, this is not pickleball. We play tennis.
Let's do pickleball.
No, we play tennis.
So you know your brother just like the rest of us do, and he refuses to make any concessions to the rules of the game. So we will be playing as an actual match. And all Pam really has to do is really score a point. So. Because that speaks of the outright arrogance
that this man has
of the tennis star Theo Reese.
It is what it is, baby. Let's go.
And also, Dr. Stroman, I just want to let you know that how a lot of stuff happens, when we're not on the air. And so he was giving me a little history that you challenged him at one point.
And you lost.
So that's where he's going with that. He's like, do you really want to be a Dr. Stroman?
My memory fails me. Was it golf? Was it basketball?
It was basketball. It was basketball. And your memory, I'm sure, convenient is failing you right now.
Was it a shooting contest?
Yes, it was. Matter of fact, it's coming back to you now, huh?
Yeah.
Huh?
Pam, oftentimes as black women, we lift up and hold up our black men.
That's
we don't
right.
want them to feel any type
man,
of
you
That's
see that,
right.
man, you see this
So
one coming.
I'm sure it was one of those days where I just said, you know what?
Do it.
Let's just love up on Errol.
That's
and
right.
make him feel good. That's
Distro, that's pretty
That's
good.
right.
You
Because
smart.
the one thing that the black woman is great at
Oh,
doing
my
for
God.
the man
Let's go
is
to a break,
affirming
man. Are you
them.
kidding me?
And you could.
That's what we're doing
she
today.
had to affirm you by letting you win.
She is Dr. Stroman. She's pretty smart. Okay.
Now I'm gonna tell you something.
What?
That's crafty, right?
I know.
Great job, Dr.
All right,
Stroman.
Distro. Love you.
Appreciate
Thank you so much.
Take care. Have a great day.
You too.
You too.
Wow. She flipped that day, did she?
Quick.
I love it.
You found yourself on the outside, like, wait a minute, how did I get out here?
Yeah.
So now that gives me my, I'm gonna play a Reese. If just by chance
Pam,
I don't win,
first of all, you can't use
then
that.
I'll be affirming him.
Pam. She already put out there, so you can't even use that one now.
Pam, you have no concerns here. I told you I'm going to recruit some real celebrity assistants.
Okay.
I'm telling you, you got a tribe behind you, and we got
a village behind you.
Village. Don't you worry, Pam. We got you. Before
right
I finish.
now, currently, I think Wednesday afternoon, late afternoons are going to be my
there we go.
training day.
All right.
Good for you.
All right. Mm-hmm. Don't train, Reese. Don't go train now. Don't get scared now.
I'm in the process of training, just get my body where I want it anyway. Have nothing to do with tennis.
Oh, okay.
Yeah,
That's see
That just started.
Yeah, just started.
Okay.
Hey, Ty,
I got a health
I'll be
rider.
ready.
what you got for this tennis